we have spirit and we have strength. But when we go home, we're going home to overcrowding housing, we're going home to poor living conditions.
When COVID reached the remote, largely Indigenous community of Wilcannia in New South Wales late last year, it hit hard.
It increased like wildfire and it went from one family to another family. You forgot about us. That's what it felt like. And now we've got a lot of angry people.
But 5 months later, the lessons still haven't been learned. Indigenous vaccination rates are still lagging behind the national average by 17%. In WA, the gap's closer to 30%. Patchy access and engagement has amplified existing issues with the national rollout, and misinformation has been especially harmful.
I urge people not to worry about the insane, unhinged stuff that's spreading online. Hello to all conspiracy theorists overseas watching this. Please get a life.
There's a lot of mixed messages out there that this is a conspiracy. Yes, I was sceptical, but now I fully believe that you've got more of a chance to beat this virus if you are vaccinated.
The sweep of Omicron through Central Australia has brought growing numbers of Indigenous communities to the brink of crisis. So, one Indigenous health service is taking matters into its own hands.
Protect men in the community you come from. Protect yourself, the harm can't be undone. Our heroes unsung, standing on the front line, mob working in health. Let them hear it one time.
So this is real. People are actually losing their lives to this virus, and in our community it's probably hit twice as hard. I think the message is loud and clear out there to get vaccinated.
Take your shot.
Please take your shot.
I took my shot for my community.
Corinda Taylor is the CEO of First Peoples Health and Wellbeing, and she joins us now. Corinda, take your shot is a simple message. Is simplicity the secret to cutting through the noise here?
Absolutely, Lisa. I think that there's a world of misinformation throughout the global pandemic, and with a really young Aboriginal population, they get most of their information on social media. So this campaign feels like it's coming maybe a little bit too late, but it really is about having something young and fresh and a really simple, clear message. We know that Omicron has killed, far more people in this wave than any other way to COVID. So it's a really important campaign at this time.
You mentioned people getting their information from social media there. I imagine that's been a real problem in convincing people to get vaccinated. But are there any other obstacles we should know about?
Yeah, I think, the changing environment and, as an Aboriginal organisation, we're underpinned by, a culturally safe, warm environment, trauma-informed care. We don't do 5-minute medicine, and COVID has felt very much like this chaotic, rapidly changing environment that, one of our biggest challenges has been able to continue to serve our community in a way that, ensures that they get the best quality care. It hasn't been easy with the changing messages.
Corinda, it's a great initiative, but is it frustrating that you're having to pick up the slack here?
We're sending a health message, and, this isn't meant to be political, but, there's a long history, as you're well aware, of government policies that impact Aboriginal people in a negative way. And this campaign is really about trying to change that narrative and lead it from Aboriginal people creating it to putting it out there to community.
Yeah, it is obvious that there are trust issues there, Corinda. So you're saying this message is, I guess, much better delivered by Indigenous leaders?
I think we are best placed to send this message. It's come at a time when, the booster uptake, isn't as successful as first dose and second dose. And we did a lot of work on our social medias at an organisational level, but we felt like it was time to really dig deep. And we are best placed to send that message. We have built rapport. Our staff workforce is, nearly all Aboriginal. So who best to share a message with people where there is trust? And our message has always been to community, come in and have a yarn with a GP. If you are concerned, if you're hesitant, whether it's dose 1, dose 2, or, more importantly now, the booster. You're half as likely to contract COVID if you've had your booster, and you're half as likely to give it to, your loved ones. So it is important.
Very important message. Thanks so much for your time, Corinda.
Thank you.